You're listening to Just a Pinch podcast with Injector Kristen. Join me and industry experts as we discuss the good, the bad, and the ugly of the aesthetics, wellness, and fitness industries. Welcome back to Just a Pinch podcast. I'm Injector Kristen here today with the absolutely beautiful Myngoc Ho.
Hi, everyone. So nice to be on this. Thank you for welcoming me
I'm so happy to have you here. You're my first in-person guest and my first video guest, so this is going to be a big learning curve, so be nice, everybody.
I know.
So Myngoc is a PA. Where did you go to school?
So I went to school at Bay Path.
Bay Path. I went to Springfield, so we were next door
we're
neighbors.
That's so funny.
And she's a board-certified, licensed physician assistant in the state of Connecticut and Massachusetts. Any other states in there?
No, just that for now.
Hey, that's good. That's good. So she has a background in neurology and medical aesthetics. She was doing both right at the same time. And how long have you been a PA for now?
Almost 4 years.
Isn't it crazy how time flies?
Oh my God, it's so crazy.
This past July, I hit my 10-year.
You look fabulous.
I wanted to throw myself on the floor. It goes by so fast.
Yeah.
It's like you blink and you're like, ooh, I'm an elder now.
It's so
gosh.
crazy. I know.
Awful.
It seems like yesterday, and then, like, you know, you go day by day, and then next thing you know, it's like years go by. But
Literally,
it's awesome.
it blinks and it's over. It's wild. But
PA power.
love it, love it. So today we are going to be talking about body dysmorphia, and there's a big reason why Miss Myngoc is here joining me for this topic. And why is that?
So I definitely want to shed light on Body Dysmorphic Disorder, BDD for short. So in our field, we do have a lot of patients who come to see us because they're unhappy with their appearance, and it could be with or without any psychological illnesses attached to it. And we're providers, PAs, but anyone else that's in this aesthetics world, from plastic surgeons to the nurses, NPs, anyone else that's doing aesthetic stuff for patients, we really need to take into consideration that we're providers first. And, you know, in this field, we make our money off of our patients, of course, but at the same time, if someone's showing us characteristics and traits that they need help medically versus aesthetically, we have to do the right thing and make the appropriate referrals.
Absolutely.
So
it's like, first off, do no harm.
Exactly.
And there's a really, in our medical aesthetics industry, kind of that fine line where we toe that line every single day.
Definitely.
We see a lot of patients with, you know, mental health conditions. I mean, let's be real, who doesn't have a little
all have
something
a little bit,
going
right?
on
Yes,
upstairs? I would say that,
absolutely.
you know, mental health conditions are far more normal than abnormal these days.
Yep.
And it's a piece of the puzzle sometimes of why people are seeking out help. And it is up to us as providers to really be able to determine what is pathological and what is still appropriate.
Yep.
So there's a whole level of screening that has to go into what we do in
Absolutely.
aesthetics.
Yes.
All right. So how do you personally like to screen people for BDD?
So for BDD, I actually wrote my capstone paper on it because
awesome.
during my rotations, I did plastic surgery, and I came across this one case right after an abdominoplasty, lipo, BBL, like totally painful procedure. A lot of patients, you know, when you go knock on their door and check in on them, they're like in pain, they're in regret, they're like, I'm in so much pain, how can I do this? But I walked into the room and this patient was just like, so when can you bring me back into the OR? Like, I'm ready to like move the stitch this way. And she was like pulling it and all this stuff. And it just kind of put a question mark in my head. Like, oh my goodness, like what is going on here? And I remember talking to the plastic surgeon that I was rotating with, and he was like, oh my God, like I think I operated on a patient with BDD. And, you know, that kind of like left a little like fire in my head. Like, oh my goodness, like that's so crazy. And it's insane because, like, you know, when we met the patient and pre-op, like she was fine, you know, you couldn't really tell anything, but it just made me realize it's so important to screen patients for this. So for me, how I screen patients is I ask them more questions of like, how does this make you feel? Right? Versus why.
Like their expectations.
Exactly. Their expectations. You know, one of the hallmark symptoms of someone with BDD is they're very, very fixated with their appearance.
Yes.
So, you know, they're going to be in the office with you and they're going to be giving you these outrageous requests.
Oh, yeah.
Tons of filler,
they're
tons
the
of
ones
Botox,
that are like,
everything.
I see this wrinkle if I stand on my head, turn to the left at the right angle with the right lighting and rubbing my head and patting my tummy. You can see that line and you need to get rid of it.
Yeah.
Huge red flag.
Yes,
huge
it's huge red flag. And, you know, it's funny because, like, most of my patients that have BDD that I've, you know, met, like, they'll be sitting in your chair and then, like, you know, we'll have a mirror on the side and they'll be, like, looking at themselves.
They can't stop.
They just have this repetitive behavior.
Yes.
You know, they're repeating, like, what they're unhappy with. They're repeating what they're dissatisfied with. And more often than not, they're perfect. Most of my patients with BDD are perfect, you know, and they're not deformed. They're beautiful, normal, and, you know, they're obviously preoccupied with the thought and, like, this over exaggeration of their minor little flaws. And, you know, it's just like a huge red flag because patients with BDD, you know, body dysmorphic disorder is often an underdiagnosed and undertreated
substantially
diagnosis for us. And as, you know, PAs, we're able to, like, easily identify someone with depression, anxiety, OCD, and BDD kind of sometimes go hand in hand with this as well too. But like you said, it's a fine line, right? Between like someone that's like, okay, I'm unhappy with my lips because it's a little asymmetrical versus someone that's very preoccupied with this. You can tell it's almost causing impairment in their functionality of their day-to-day life.
And it's an obsessive thing. And I find that you can sometimes, I mean, unfortunately, in aesthetics, we've all treated that person with BDD that we didn't recognize beforehand, and I mean, there's nothing like kicking yourself in the butt after the fact, and now you're trying to figure out how you're going to manage this person and manage what you've done, because once you open that can, I mean, they're yours.
Yes,
they're yours.
Definitely yours.
And it's hard. It's so hard to manage. I've noticed that with post care for people, sometimes it shows up after the procedure and not even before, because unfortunately, some people that have BDD, some, not all, some, can be very almost, and this is, they're not always together, but they can be sometimes very manipulative.
Oh, absolutely.
And they know what to say during a consultation to get you to agree to do those things, and they know what not to say and where to hold back. So those are some that, you know, despite our best efforts, like, you can't, but it'll show up afterwards. So sometimes you can catch it before that next encounter. They're the person that's going to be reaching out to you on all platforms. Every day,
all hours,
all
2
the
a.m.,
problems.
3 a.m.
Yes. Oh my gosh, I have gotten the 3:30 in the morning text messages before. I mean, it's insane. But there's a difference between somebody being a nervous post-injection, post-procedure patient that needs a little bit of hand-holding versus somebody that's post-procedure perseverating on their result.
Yeah, it's almost like harassment.
It is harassment.
You know, I mean, I'm sure you don't say it like for patients to not want to reach out to us. Of course,
Absolutely.
if there's ever a time my patients need me, I'm there.
To this.
But there's definitely levels, and that's why it's so important to try to screen so hard. Like I put it into like my pre-consultation with them, right? Like I'm asking hard questions like, how does that make you feel? Do you ever camouflage it or hide it from others? Because sometimes they'll be avoidant with their looks, and even sometimes their appearance. Like it'll be someone that comes in with like so much makeup that doesn't need it because, you know, in their mind they're trying to hide it, and a lot of them would turn to aesthetic procedures like cosmetic surgery or injectables because they think it's going to fix it, but it's going to worsen their symptoms, which is why you see it a lot afterwards.
Absolutely.
When they're like harassing us because, you know, it worsens their symptoms. And like the appropriate treatments, referral to psych, medications such as like SSRIs or TCAs, which will help, or, you know, even just therapy. I mean, all of us can use therapy, but there are studies that show like cognitive behavioral therapy, which is tailored to BDD, is one of the most beneficial things that will help them kind of get out of all this negative continuous feedback that they have in their heads about themselves. But it is interesting that you bring up that you sometimes see it afterwards.
You see it after.
Sometimes it's more than just like, you know, a dissatisfied patient. It's someone that's writing a bad review. It's someone that's going to sue you.
Oh yeah, threats. Always the threats.
Exactly, it's threats, and then, you know, not only the legal like limitations we have to worry about, but sometimes safety too. In my capstone, I was studying it, and I was like looking at all these articles, and there was this one article from China where 3 plastic surgeons got murdered by their dissatisfied patients. So not only is it important for us to screen because 1, our reputation, 2, the do no harm,
absolutely,
but 3, our own safety.
For sure. I mean, I always think back to like, I mean, this ages me a little bit, Nip Tuck, the TV show Nip Tuck. There was that episode where you have that psychotic BDD patient that showed up and attacked the surgeon. And this happens. And I mean, this can happen across the board, but in aesthetics, it's usually coming more from a level of dissatisfaction and obsession. And it becomes obsessive behavior where they can't think about anything other than their appearance. And they become very, it's the term I'm looking for here, kind of just sickly attached to their aesthetic provider or surgeon because they are relying on that provider to give them what they need to feed this addiction. And to some degree, BDD can go hand in hand with procedural addiction.
Yes,
people become addicted to these procedures.
Sad, you know, just like any other type of addiction, whether it's alcohol or drugs, like surgery or aesthetics is definitely an addiction they can get, and it's up to us at the forefront to hold it and like take care of these patients because they're coming for help, and sometimes we realize like injectables isn't the help they need, and appropriate referrals. And I mean, sometimes it's hard to have that conversation. It is, like, to turn a patient away, you know. And I have that one patient that came in that was beautiful. She was like, you know, like, so I was like, okay, like, what brings you in? What did you want? She was like, well, I want you to break my jaw and like realign it. I want you to like cut my eye and like lift it up. And I do injectables, like, you know, Dr. A does all the surgery parts. So I was just kind of like, I don't know if you think I could do that in the office, you know, and just going on and on. I had this whole list. And, you know, since I have the background in this, like, it's like screaming BDD, BDD, BDD. But like, you know, for new injectors or injectors that are not really so familiar with patients that come in with this, like, you can mistakenly see as like, oh my God, this is going to be a good day because I'm doing multiple syringes and that. But then, you know, it's important to kind of reel back and be like, hold on, like, there's something off here. And you have to trust your gut. And, you know, the patient is like crying and she's like, you know, really, really fixated on her looks. And I pull the chair down. I'm like, listen, I'm not going to inject you today. At the end of the day, I'm still a PA first. I'm a provider first. And it's awkward when you have this conversation. It's not easy, so you know.
Uncomfortable.
Yeah. And I was just like, you know, I'm sorry, like, but this isn't what you need. Like, how can you expect me to hold a needle to your face if you're crying in my chair, right? There's so much going on here, and I feel like it's inside. And if I'm working on the outside, it's not going to make you feel better. And
absolutely.
Like, I reassure the patient, like, this is how I make my money. If I'm telling you no, like, that's huge.
I tell people that all the time.
And
we don't make money if we're not treating you.
Yeah.
So if your injector is telling you no, you've scheduled your appointment, you've come into the appointment, you're in the chair, and your injector's talking to you about the procedure, and they're telling you no for any reason. They're telling you no. It's for a good reason, whether you have, you know, the level of BDD where you don't see that your lips are overfilled and to you they look small, that you don't need any more filler in your cheeks because you are at max capacity, honey, but you see them as small and you think that you need more. We'll turn you away for that reason, and we'll turn you away if psychologically you're not where you need to be that day or in general. And those are really important things. So if your provider's telling you no for any reason, know that it's really difficult for us to say that.
Yeah.
And it's uncomfortable. We're not trying to make you feel uncomfortable.
Yeah.
We're not trying to start a fight. We're not trying to be combative. It's because we have your genuine best interest in mind.
Yes.
Secondarily, I don't like phone calls. I don't like angry phone calls. Nobody does. But first and foremost, it's to do no harm. And sometimes the best treatment that you can give a patient is to not treat them.
Exactly. And I love how you put that because it's so true. And it makes me so happy to hear that you do the same, you know.
Absolutely.
And like,
it's
patients
so
are very blessed to have providers like that. And I'm sure all providers want the best interest at heart. And I think sometimes people in today's world, like, a lot of aesthetics is online, right?
Yes.
So sometimes I have patients coming in and they already have like the rundown of what I'm going to do for them. But I think sometimes they forget that, like, it's still medical. Like, we're still doing prescribed medications, like Botox is prescribed or any of the other neurotoxins. The dermal fillers are really dermal implants that we're placing into people. And I think people kind of forget because it's like we get lost in the glitz and glam of it. But at the end of the day, like, we're still providers and we're still medical as if you were see us in the hospital setting, you know, like, we're still going to carry that same amount of education we worked so hard for to provide the best care. And I think sometimes, like, you know, social media and the glitz and glam can kind of camouflage that. Because if it was in like a setting in the hospital where we're prescribing antibiotics, like, no one's gonna ask for like half the dose or like, you know, negotiate with you. So I just hope that this sheds lights on patients to see, like, you know, sometimes we're not just being mean or anything, and you're gonna thank us in the future when you're not looking overfilled or unnatural.
Absolutely.
Or if someone out there that has BDD, like, you know, that patient that I turned away, of course, she was like pretty upset, but she like ended up taking the referral and coming back a couple months later in a way better state of mind. And she was like, you know, I'm so glad that you sent it. She was like, I'm not gonna lie, at first I was really annoyed and I was really upset because in my mind, like, I needed this fixed and I need it fixed right now. And it's not always the quick solution. And now she's like a loyal client forever, and she needed one out of like the 10,000 things she thought she needed at that time. Not all patients are gonna be like that, of course, but like, you know, it does feel good when you're like, I did the right thing.
I found personally as a provider, a red flag that I've noticed in consultations is somebody comes in and they say, you know, I've been to 6 different med spas. I've been to, you know, 7 different providers. Nobody can make me happy, but I know you can make me happy. I know you can give me what I'm looking for. Time out. Big time
That's
out.
a big red flag.
Huge red flag. Absolutely huge. And that's where, and not 100% of the time, not 100%. I can say that I have had patients that I had my qualms about at first. I saw red flags, but for whatever reason, I still felt comfortable moving forward with very delicate, slow, conservative treatments. And in time, they've proved themselves to be really good clients. Their expectations are not crazy. They're happy with their outcomes. They're not perpetual complainers. So, but that's kind of far and few between. Usually if you're hearing that, it's a huge red flag that it's a body dysmorphia, perfectionism, narcissism type of thing where nobody can make them happy. But they want to put you on a pedestal. Having somebody put their provider on a pedestal. Oh yeah, they will shower you with compliments. You know, try to make you as the provider feel like you are just this god in their eyes. And that's a huge red flag. You know, compliments are nice. Absolutely. We all love hearing them. We all love to hear from our happy patients. But there's levels to it. And overindulging your provider is a big red flag that you're trying to manipulate us into to doing something.
While putting other injectors down.
Exactly.
And like in this field, you know, community, not competition, is so important.
So important.
And it's not about like, you know, anything other than supporting one another, even if you don't work at the same place. So if I hear someone coming in and they're talking about you, like my first instinct's gonna be like, oh, so then you're gonna go to her and talk about me.
Exactly.
You know, like it's such a small world.
Yes, it is.
You know, like I feel like I can say with confidence that, like, you know, injectors that I've met and got to know, like, we all have each other's backs and we all want the best for our patients. And sometimes, like, you know, it could be a patient that like I turned away for BDD, gave the appropriate referral, and then we'll go and sit to you and like tell you all that stuff to distract you from all those signs. But, you know, like, not like that. We don't do that.
No, definitely we don't do not. And it really is a big red flag if you were to come in and say, you know, Jane Doe down the street did my filler last time and it came out so bad. She's so bad at this. You know, she was just nasty. She, you know, and like telling people by name. What I respect more is if you did have a poor experience with another provider at a different med spa, honestly, I don't ask. I don't ask where you went because I don't care where you went. And if you just come in and say, you know, I've been to some other places, I just haven't been satisfied for these reasons, or this is what happened, I respect that. And there's nothing wrong with that. So by all means, don't hold back on telling us your history and what injectables have worked well for you, what procedures have not worked well for you. But it's a matter of quite literally shit talking or not. And we don't want the shit talking.
No mean girl vibes. You know, we don't do that.
Because it's going to make me not want to treat you, because I'm going to then fear that you're going to go to the next place and be talking poorly about me. And so no provider wants to have to deal with that.
No,
so
and
be
nice.
It
puts us in a really awkward situation, you know,
does.
because it's like, especially if it's a first time client and they're like telling you all this stuff. And like I said, here comes social media again. Like they like see our social media. So they get like to know you before they even meet you, you know, and it puts me in a situation where it's like, I know I'm not going to like indulge into that and be like, oh yeah, I heard that person was bad too. Like, oh yeah, I'm way better. You know, it's about professionalism. Like you said, at the end of the day, history is important for us to know what worked, what didn't work. But like, you know, I hope patients can see why sometimes we are just like, yeah, we can't go further than that. It's like, I'm sorry about your experience and let's try to come up with an individual game plan for you moving forward.
You can tell me what went wrong, but I don't care where you went or who you saw. That part of the pie does not matter to me. And if for whatever reason it does matter, we'll ask. But I mean, I've never had to ask as to where you went. You know, because it's never been anything that is dangerous or something that I see that should probably be reported.
Yeah.
You know, that would be the only time that I would really care about who did what. Other than that, there's no reason.
Yeah, it's true. But yeah, I'm so glad we had this talk about BDD.
Definitely.
It's definitely very important. Mental health is so important. I remember rotating in psych, and you know, the doctor I rotated with was like, sometimes I'd rather have cancer than like a mental illness because it's more accepted by society.
It is.
So with like this discussion, like I hope it comes across as shedding light on something that's so important,
and it's common.
And it's common, like, you know, and we all have like various degrees of BDD, but it's just when it's like, you know, certain levels where you just need help and the help isn't in injectables.
Exactly.
You know, it's gonna
be doing you a disservice.
Exactly. But you know, with that being said, like, I hope all patients are comfortable coming to us and expressing how they feel, but I hope that they're open for like our PA mind to be like, okay, like, this is why I think it's going on. This is what I believe is the appropriate treatment for you. Even if that means that I'm turning down this service, I'm turning down money, but I would rather do that because at the end of the day, I didn't get into this field for money. I wouldn't have been a PA.
Oh my gosh.
But
you get into this field for money and just blanket treating everybody that comes into your office, you are going to be left with a pile of messes to clean up.
Yep.
And a lot of angry and unhappy patients. And
and they get more and more violent and aggressive,
escalates.
you know.
It
So safety,
absolutely
more
escalates.
importantly.
Absolutely.
And then your reputation and like the legal stuff. Like, I'm sorry, I do not want to be in a courtroom with a patient.
No.
I don't want that, you know. So
and there are times as a provider that we may need to dismiss you as a patient. And that is also wildly uncomfortable for us to do. And that's quite literally our last resort. But if we feel that we genuinely cannot make you happy, we are concerned about the risks of treating you, you know, it's going to come in one of two ways. The nice, easy way is when we look you in the eye and say, you know what? Based on the expectations that you have, whether this is BDD or just general expectations, is, you know, I don't think that I can meet the expectations that you're looking for, and I wouldn't feel right taking your money. Or if it's BDD, I don't think that treatment at all right now is the appropriate thing. Let me give you some contact information and referrals. So it can be as simple as that, or it can be you've escalated. You know, you've slipped through the cracks, and you know, now we quite literally have to dismiss you as a patient and call you and have that really uncomfortable conversation saying that unfortunately you're no longer welcome to book services here. And you know, it's
all out of love, though.
It is. It's all for
love.
the better reason. You know, we're trying to do what's best for you first and foremost, and what's best for us, you know, secondarily there.
It's so true. It is uncomfortable. I mean, I remember when I went to get my hair done, and I've gone to my hair girl for years, and you know, I keep trying to push that blonde, and I have like this like, super dark hair that pulls orange all the time. And my last visit, she was like, you know, like, we can't add any more bleach this time. And I remember feeling kind of like, not even a little bit, like, we can't try and this and that. And I was like, oh my god, I sound
negotiations.
Like my patients.
People negotiate.
I was like, oh my god, I sound like some of the patients who have that. And
you
know, like, I agreed with her. I was like, okay, maybe next time and this and that. When I left, like, I was just like, you know, I really appreciate her in the end because I'm not trying to have all my hair break off.
Exactly.
I've been there, done that before.
She said no to you for a reason.
Exactly. And I was like, this is how the patients feel. But then at the same time, it kind of made me feel a little relieved because, you know, when I left and I thought about it more, I was just like, I'm so grateful for that. And I hope that like all patients will feel that way. Like when I say no, like, I mean, it's different from hair bleaching, but kind of similar concept.
For sure. Yeah. So it might make you feel, you know, a little sad, disheartened, or even angry at first. And that's okay. You can feel however you need to feel, but just know that we have your absolute, you know, best intentions, and we want you to have really good long-term results and long-term goals. We're looking past the immediate dopamine rush that you're going to get from your initial treatment.
Yep, for sure.
All right. So to wrap up here, we're going to have a little fun, and we're going to learn a little bit more about Miss Myngoc. We're going to play a little 20 questions.
Okay, I'm excited.
I'm going to ask you some simple questions, and I want you to give me just kind of the first thing that comes to mind.
Okay.
Favorite color?
Glitter.
Ooh, I like that.
Some will debate that that's not a color, but I just love anything glittery.
What's your favorite social media trend currently?
Reels.
Love reels.
I love being able to just show people other than just perfect pictures, right? I want to show people like me being quirky, or like, for example, when you put your bloopers up, like I love that. I love it, you know? And so reels right now.
Perfect. Least favorite social media trend?
The dances. I'm sorry, I can't dance on cue.
can't.
Like if you see me out, that's different. But like if I'm trying to like memorize like certain, I just can't.
No, my cheerleading days are long gone.
Were you a cheerleader?
Oh my gosh, I was. Yeah, in high
my
school and college. Crazy.
I love it. Badass.
So what are you watching currently?
Right now, I just finished Handmaid's Tale. That show is definitely one of my shows I've been watching actually since PA school. And I'm waiting for the next episode to come out.
Season 2, episode 1, still chills everywhere. If you don't know, go watch it. Season 2, episode 1. What is your current favorite podcast, educational or entertainment?
You know, I really don't listen to podcasts.
Okay.
So you are my favorite one. When I saw you do it definitely sparked an interest. And I commute like so much with my drive from Boston to Northampton to Mystic. So I'm going to be listening to you and maybe exploring more podcasts.
Awesome. Oh, and speaking of her commute, you can also find Myngoc in Northampton, Massachusetts at Vallon Medispa with Dr. Allcroft, or now in Mystic at Cure Medspa.
So excited.
Awesome. What are you reading right now, if anything?
I have not been reading. I've just been so busy with the commutes. But you know those books by Colleen Hoover that everyone's been reading? Have you read them?
I fluctuate. I go on kicks of reading where like I will binge read in like a day or two and then like won't read anything for months.
Yeah. So that's on my
Colleen
list.
Hoover, definitely. so good.
Yes, I'll be reading that soon.
What is your overall favorite book in general?
My favorite book in general. It's going to sound really dorky, but it was that one The Polar Express.
Oh, it's so good.
Yeah,
It's
in
so
elementary
seasonally
school, it is seasonally
appropriate.
appropriate. And just, I remember like, you know, being in school and it was just so magical. I just love the holidays and that will always be one of my favorite books. I will read any other book, but I feel like that just has a special place in my heart.
I love that. The Hungry Caterpillar's mine.
Oh my God, I love that one too. I love it.
Mostly because we can just keep eating and eating and eating. What is your favorite word?
My favorite word. Lately, it's been my like Instagram name, the Ho. My last name is Ho, so it's the Ho Injector.
I love that.
And I've just been like so fixated on branding it. So I think that's the first thing that comes to my mind.
Love it. Do you have a least favorite word?
Least favorite word, moist.
Yeah,
moist.
Favorite movie?
Favorite movie. I watch more like TV shows than I do movies, but You would be my favorite TV show if that counts.
My gosh, it is so good. That I binge watched when that came out. So good.
What's your favorite movie?
As of so I don't. I would need like a whole hour to like divulge into like my all-time favorite to rack through. But my very favorite right now, because I just watched it on Halloween, was 1991 Wes Craven, The People Under the Stairs.
Oh.
Like, I can't stop thinking
I'm going to have to watch it.
It's crazy.
Really?
It's crazy. There's levels of crazy to this.
Yeah.
And for so many reasons, it's wild. People Under the Stairs, 1991. It is everything that you want out of 1991. Allegedly, word on the street is that, who's doing the remake of it? Who did Get Out? Who was the director for Get Out?
On the tip
of my tongue. That guy is allegedly working on a remake of it, but that was released in 2020, so I can only hope that means that it would be coming out soon, but we'll see. I can only hope. Who is your favorite musical artist or group?
I really love my hood music.
Same, girl, same.
So I love Drake, I love Kanye, I love Future.
Love it.
All the hood stuff.
I listen to it all. I love it. Love it, love it, love it. What would be your favorite food or meal?
Food or meal? I'm such a foodie.
I know.
Depends on my mood.
Oh,
lately,
your food Instagram is amazing.
Thanks. Lately, I've been getting a lot into like sushi, but like moving out to Boston, they do like very like intricate artisanal sushi and sashimi, like diving into like the raw flavors. I could never do it before, but it's just like my jam.
It's grown on you. Oh, how fun. What's your favorite place to visit?
My favorite place to visit, Aruba. I went for my birthday once. The people are just so nice and it's just so safe and the weather's just consistent. A flamingo bit me in my butt though.
Oh my gosh.
I would go back.
I don't love birds. I have a problem with geese. Canada geese are not my.
I didn't know flamingos were that aggressive.
Yeah, neither.
Yeah. Yep. So watch your booties. You go to Aruba.
So this is a really loaded question.
Yeah.
Who's your favorite person?
My favorite person? My goddaughter Mila.
Oh,
She's 7. Her name's
have a
Camila.
nurse, Mila.
Really?
Nurse, niece.
Oh, I was like nurse. Oh wow.
Your personal nurse.
Yeah,
Yes.
Camila. I feel like
Oh.
she reminds me of the small things in life that really, I get so caught up in like, always like being competitive with myself or like worrying about the next step or where I'm going next. But when I'm with her, everything just slows down and it just reminds you like, life is just so beautiful and like the simplest things.
Definitely.
Even if it's like cheese pizza or a burger,
I love that.
something like that. And she just, I just love her. She
that.
just makes me feel so good.
Oh, good. So if you could meet anybody dead or alive, who would it be?
Dead or alive? That's a good question. I don't know. Let me see. Let me think of someone who I would love. Kim Kardashian. I love her.
Get it, girl.
Yeah, I love her.
What
She's
a
such a
mogul.
boss babe.
For
Yeah.
real. I mean, if we want to talk about aesthetics, the Kardashians have largely shaped the trends that we're
Absolutely.
seeing today in
Yeah.
all areas of aesthetics and plastic surgery. So
Yeah. No, it's true. We have like a back door at Dr. A's office. And when I did my rotation, there was a back door there too. And we don't use it. Like, we don't use it anymore. But I remember back in the day, like, the staff would tell me like, oh my God, it was this big deal. Like, people will come into the front and leave through the back. So you don't run into people. And now it's like people are posting reels and videos of them getting injected,
Exactly.
and
Yep.
before and afters. So I definitely think the Kardashians definitely helped shape it. And
Oh,
it's so
for
funny
sure.
when you think about the way it was before.
they let you just like own it, you know, no judgment. What advice would you give to your 18-year-old self?
My 18-year-old self, just keep going. I feel like I've always been just very hard on myself my whole life. And I think just now I'm taking the time to slow down and be like, you know what? You're not doing too shabby for yourself. So if I could go back to my 18-year-old self, I'd just be like, just keep going and just enjoy the ride and the journey, and that we're going to be just fine.
Love that.
Yeah.
Who would you consider to be your role model in life?
Role model in life. Well, professionally, I would say Nina and Dr. A. I met Nina when I was rotating, actually, and she taught me a lot about aesthetics and plastics. Dr. A is just, since I've met him, he's just been this really great role model. So smart, so brilliant, so humble, and so encouraging. So, yeah, definitely those two.
Oh, that's great.
Yeah.
What was your favorite class either in high school or college? Any favorite class stick out in mind?
Favorite class? I was always really good at like English and like writing. Math and science was not my thing. I was the one Asian girl you did not cheat off of in math class. Like, nobody sat next to me. They're like, stay away from her. I don't know what happened with this one.
Math was not my jam either. Like science, I was good with, like the biological sciences.
Yeah.
You have me do math or physics.
Yeah.
No, that is my
no.
brother. He's the engineer.
Yeah.
No. Like, I don't even think I could do, like, I can do med calculation level algebra, and that's where it ends.
Yeah. For Bay Path, they made us, so I went to Bay Path for all 6 years. And to apply to a PA program to, like, get my bio degree, we needed to take up to Calc 3.
Oh, ooh.
It was terrible. Terrible. Yes, I cried every day.
Oh my gosh. Oh my God. When I was in college, my calculus professor was European, and the way that they taught algebra in Europe, and this is just what I remember, was very different than the way that we learned it here. So he would keep referring back to doing these algebraic equations in this European way. This sounds ridiculous, but like I could not follow the way that he would teach. So and I was so bad at math that I just stopped going to class. I bought Calculus for Dummies. And I literally taught myself calculus at home and would just show up for tests and quizzes based on the topic. And I got an A-.
Yeah. I don't know if I ever got an A in math.
That was the only math class I ever got an A in. Otherwise, it was like, oh, Kristen's doing great. Ooh, except for math.
Yes. Oh my God. Yep. Nah, I don't know what happened with me, but no.
My brother just sucked up all the math and physics brains and out of my parents' gene pool. I was left with nothing. Chocolate or vanilla?
Vanilla.
Oh, I love that.
How about you?
Honestly, when given the choice, I love both of them. Vanilla.
Yeah.
Vanilla. To me, like for ice cream, there's nothing better than a soft serve vanilla cone with rainbow sprinkles.
That's my favorite to go
it's
order.
the
Oh my
best.
God.
It is just the best.
You can tell a lot about a person based off their ice cream order.
Oh, absolutely.
Or like if they like, my brother does this and it drives me bananas. He'll get like ice cream and then like whip it until it's like the soupy mess.
they make the soupy.
I can't.
My Nana used to do that.
I can't.
Makes me, yeah, no. Vodka or tequila?
Tequila.
Same. I used to be a vodka girl.
Yeah.
Now, tequila all day.
I used to be a Henny girl. It's part of being Asian, I guess.
Yeah.
I grew up like that. My mom will literally greet you at the front door with a shot of Henny and a glass of Henny to chase, and then you can come in.
I love it.
But we all kind of switched to tequila. Tequila's a cool thing now,
Yep.
I guess.
Oh, love tequila. So now that we're done with kind of the basic 20 questions, just a couple more aesthetic-based questions. What is your favorite procedure to perform?
Yeah. So my favorite procedure to perform is full facial balancing, right? When someone comes in, sits in the chair, and they just kind of give me full reign on what to do.
It's
Like,
the best.
I just want to be more balanced. Like, I fully trust you. And that's when I can kind of break the face down into the threes, upper third, mid face, lower third, and give them suggestions. And, when I get that green light, just harmonizing the face. That's my favorite thing to do. But of course, I love like lips, all that stuff too. Some people will travel for lips of mine, but I think full facial balancing is definitely where I'm like,
Love that.
I get really excited.
Now, what is your favorite procedure to have performed on you?
Botox.
Oh, same.
Botox everywhere. I get like 172 units.
Oh, the amount of Xeomin that's in my face right now, just on the upper, I've learned. So as much as I feel like I need neuromodulation in my lower face, like, because like I do weird things. I'm super asymmetric. Whenever I do it on myself personally, I can't stand it. Like, my DLIs are clearly not where they should be. If we look at like any anatomy, anytime I try to get my DAOs or my mentalis, my DLIs always get affected. So then I'm looking crooked and weird, or like I'll smile and my lower lip will not drop and it just goes, it goes up and like weird things happen. So I use an insane amount all up yonder, and it's so good. And if you've been following my @InjectorKristen page, you saw me suffering, and I do mean suffering with a capital S, waiting to get my Xeomin done, and had everything worn off for like 2 months because I was waiting for my timing to be right for my birthday and the holidays, because otherwise if I did it right when I was due, everything would have been wearing off but not yet able to be done right when I want to be looking good. So I forced myself to sit on my hands and not get it done, and I just didn't feel like myself.
You feel off. I do a brow
do.
lift. Some of my brows start falling. And I swear I have like the world's biggest forehead. So like psychologically, I think when my brows are lifted, my forehead's like shrunk a little bit. But yes, no, I completely agree. I think I love it so much.
As soon as you start feeling it kick in, you're just like, it's just chef's kiss. So good. Now, what's your favorite skincare product?
Favorite skincare? Ooh, that's a loaded gun.
I know.
So I've worked with ZO, Skin Better, SkinCeuticals. And I feel like I play with all of them, but I somehow go back to ZO. I do.
What's your favorite product out of their line for your skin?
For my skin, I really love the growth factor serum. I think I'm just addicted to the smell of it.
It smells so good.
I love it.
Growth factor serum from ZO is like my special little secret. It's not a secret. I tell you guys this all the time. If you're using tretinoin on your skin and you tend to get a little bit more irritated, if you put your tret on first and then put on a nice little layer of that growth factor serum, your irritation, redness, peeling, flaking goes down dramatically. I have really sensitive skin, and that is my little secret to being able to tolerate tret. I love that stuff.
I'm totally going to use that trick.
Oh, it's so good. And so I already asked you about your role model, and this one was about industry, but we already
we were touch base.
The same one.
I know.
So good.
I know.
So Nina, we love you.
We do. She's
awesome. We need to get you on the podcast.
I know. She's so brilliant.
She really is.
I learned so much from her every time I'm in the room with her.
I know.
I'm so sad she's in Florida. Who's going to inject me now? You?
Well, thank you so much for coming on the podcast. This was so much fun. It's so much better to talk to somebody else other than just myself. And I'm sure you guys are loving actually hearing a little fun banter back and forth as opposed to a little bit lecture from me.
I know.
But please take a moment to subscribe and follow on whatever listening platform you're listening or watching on. Hopefully watching now. That would be on YouTube. Give me a thumbs up, rate and review, and be sure to tune in next week. New episodes drop every Monday at midnight. So we're there for you for your morning commute on Monday.
You're the best. I'm totally subscribing to all that stuff.
Love it.
Bye, guys.
Bye. Just a Pinch podcast was written, recorded, edited, and produced by Kristen Gem.